Good morning, ladies and gentlemen. Welcome to the 4th National Myeloma Patient Forum. I'm Elaine.
女士们、先生们，早上好！欢迎来到第4届全国多发性骨髓瘤患者论坛。我是刘星。
We are your MCs for today.
我们是今天的主持人。
Thank you all for coming because this event is possible only with your presence.
欢迎各位的光临，有了你们的出席，这个活动才能顺利举行。
Annually in March, we hope this platform will continue to give both myeloma patients and their caregivers the opportunity to gather, make friends, and share personal experiences to encourage one another.
每年的3月间，我们都会举办这一论坛。我们仅希望通过这一平台，在众多骨髓瘤患者和陪护人员之间建立起一座友谊的桥梁，让他们通过分享彼此的经验来鼓励对方。
The message we wish to spread is that you're not the only one and you are not alone in this journey.
我们仅希望通过我们的努力去传递这么一个消息：您不是一个人在战斗，您在前行的路上从不孤单。
Lined up for you is a series of informative, interesting, and inspiring programs.
接下来将为您奉上一系列知识性、趣味性强并且振奋人心的节目。
Apart from the talks by our healthcare professionals, after lunch we will have a Q&A session with our panel of speakers.
除了安排我们的专家为您做精彩的演讲，在午餐后还特别设置了问答环节，让大家与今天出席的专家进行互动。
The slides from today's talk will be uploaded, so please leave us your email address at the reception desk if you are keen to be kept informed.
今天论坛中涉及到的所有简报文件，我们在稍后的时间都会上传到互联网。如果您希望收到今天的简报文件，以及希望了解到我们将来的病人活动，请留下您的联络方式，包括电话、电子邮件，以便我们可以联络到您。
Do pay close attention to today's events, as we will have 2 quiz sections where small gifts will be awarded for the correct answers.
另外，本次活动还设置了2个小测验环节，请各位认真听讲并踊跃回答问题。答对问题的来宾将有机会获得我们精心准备的礼物。
To start today's program, we wish to call upon Associate Professor Chng of NUHS to open us with a few words.
首先，我们将邀请庄伟玉副教授给我们讲几句话。
Good morning, and I would like to extend a warm welcome to everyone to come to this 4th Myeloma Forum meeting again. I was looking at this recollection of all the photos of past events that we have had, and it's amazing that we are already at the 4th year. So looking at these things, where a number of things have changed. The girls have become much more beautiful over the years. My hair, much less over the years as well. And I've become much more casual as well. Look at the suits and ties and then in the previous meeting. But I think this is a positive evolution because we have become like a big family. We are friends in this room. So I don't think that we should distinguish ourselves as the doctors or the patient. But we should be free to exchange ideas and opinion about our illnesses and how to actually improve treatment and access to treatment for our patients. And I think this is absolutely the platform for us to do this kind of thing. And we have been incubating ourselves for 3 to 4 years now. We have become a much more solidified unit. And we have many patients here that may have connections that may help move the myeloma agenda forward. So I would just like to mention a few things which are my hope for the future of this group. So one of the key things that I feel is that we have been gathering in a much more kind of social setting. Our regular meetings have been based around activities of maybe fun and bonding and sharing. But I was gratified by the fact that some of my patients actually came forward to me in clinic and say that, they want to do more than what we are doing now. In fact, they want to actively provide support to other patients. They want to make themselves available to other patients who are newly diagnosed, who has questions about their treatment journey, and they want to actively be available to talk to them, to visit their home, visit them in the hospital, and provide either counsel or support as someone who has gone through the journey. I think that's a very positive thing. So as one of the things that we hope to take away from this meeting is that for those of you who are also interested and have time to help out in this kind of efforts, to leave your kind of contact and name behind, and what we hope is to form a group of you that will be willing to do this, and this will benefit patients from all over the island. Whether it's someone diagnosed in a private practice, in SGH, in Tan Tock Seng, in NUH, they will potentially benefit from this. And this will help a lot with some of the fears, that patients, when they are first told of the diagnosis or some sort of treatment that they may have, to listen from a fellow patient who has gone through it, and it is much more neutral and independent than a physician who tells them that, it's going to be okay, this is going to be the best treatment for you. Because there's always a feeling whether, at the very beginning when the relationship between doctor and patients are not very strong, whether, this is the right advice or not. But if you hear from an independent person, a fellow patient, that's always much more convincing. So I think that's one of the very useful things that may emerge from our, our group. The other thing that I want to mention also, that moving forward, is that we really need to look into maybe some fundraising activity or effort. Now, I would just want to say that, today I received a check, and this is, I need to acknowledge Mr. Wong Tun Jin, who is one of our fellow patients, who actually very kindly donated a check for $10,000, out of his own account. So, thank you very much. And we wanted this money to be used for myeloma, for activities for the myeloma group, So that is one positive step forward, but I think we should do more, because the people who may benefit from this money may not necessarily be sitting in this room or be the active, regular participant of our activities. My hope for next year, which is the 5th year of the forum, and meaning that we've been doing this for 5 years, is a kind of nice milestone that we have, is that if we can launch something like a myeloma fund for Singapore patients, which may look into small expenses like their transport to hospital for patients who are really needy, and to maybe even supplement some of the other medical costs on top of what is available in the public healthcare system at the moment. And I was again gratified that as a separate conversation, Mr. McCarthy, who's going to share his experience as a patient with us later on in the afternoon, was again talking about some opportunity for fundraising through other mechanisms, like putting up a concert for the myeloma effort. And I think now that we have a mechanism where we can collect and keep this money dedicated for myeloma activity, we should try to do more in these aspects, but at the same time, we need to have people who are interested and active to maybe start to form some governance, a body that actually prevent the misuse of this money. Okay, because I think that's important when we have more and more, potentially more and more donation, charity effort coming into this pool, and we want to make sure that the money is used in the best way possible. So these two areas are really my dream moving forward for the next few years, and I think we've come a long way, and we are really at the stage where we can seriously think about some of these efforts. So I think I wouldn't hold the meeting up further, because there are a lot of exciting activities, and I was told of many surprises. So for those with a weak heart, you better brace yourself. And I'll give the program back to Liu Xing and Lee.